Hi everyone. Today we are going to discuss about primary health care. My name is Sasi, working as an assistant professor in Tribhulam College of Nursing. Objectives: the students is able to define primary health care, explain concepts of primary health care, enlist of principles of primary health care, narrate the elements of primary health care. Introduction. Health is a state of complete physical, mental, and social well being, and not merely absence of disease or infirmity. Health is a fundamental human right. The state holds the responsibility for health of its people. National governments all over the world are striving to expand and improve their healthcare services. The current situation in urban oriented, mostly curative in nature and accessible to small part of population. At the international level, the Universal Declaration of Human Rights established a breakthrough in 1948 by stating in Articles 25, everyone has the right to a standard of living adequate for the health and well-being of himself and his family. The preamble to the WHO Constitution also affirms that it is one of the fundamental rights of every human being to enjoy the highest attainable standard of health. Increasing importance has been given to social justice and equity, recognition of the crucial role of community participation, changing ideas about the nature of health and development. The importance of political will called for new approach to make medicine more effective in the service of humanity. Against the above background, the 30th World Health Assembly resolved to May 1977 at Alma-Ata that the main social target of governments and WHO in the coming decade should be the attainment by all citizens of the world by the year 2000 of a level of health that will permit them to lead a socially and economically productive life. The culminated in the international objective of health for all by the year 2000 as a social goal of all governments in the joint WHO-UNICEF International Conference in 1978 at Alma-Ata. The governments of 134 countries and many volunteers agencies called for a revolutionary approach to health care. Definition: primary healthcare may be defined as essential healthcare based on practical, scientifically sound, and socially acceptable method and technology made universally accessible to individuals and families in the community through their full participation and at a cost that the country and community can afford. Primary healthcare. Health for all means that the health is to be brought within the reach of everyone in a given community. It implies the removal of obstacles to health, that is to say, the elimination of malnutrition, ignorance, disease, contaminated water supply, unhygienic housing, etc. It depends on continued progress in medicine and public health. Alma-Ata Declaration called on all governments to formulate national policies, strategies, and plans of action to launch and sustain primary health care as part of national health system. It is left to each country to innovate according to its own circumstances to provide primary health care. Primary healthcare. This was followed by the formulation and adaptation of the Global Strategy for Health for All by the 34th World Health Assembly in 1981. Primary healthcare got off to a good start in many countries with the theme of Health for All by 2000 AD. Primary healthcare is a new approach to healthcare which integrates at the community level all the factors required for improving the health status of the population. Concepts of primary healthcare. Primary health care is for all, especially the needy, regardless of social and economic status. Every individual in the nation must have access to good health care. The service should be acceptable to the community and there must be active involvement of the community. The health services must be effective, preventive, promotive, and curative. The service should form an integral part of the country's health system. This program must be efficient, multi-sectoral because health does not exist in isolation. Principles of primary health care. The first principle is equity and community participation, intersectoral coordination, appropriate technology. We'll see one by one the principles. First one is intersectoral coordination. Declaration of Alma Ata states that primary healthcare involves, in addition to the health sector or related sectors, an aspect of national and community development, in particular education, agriculture, animal husbandry, food, industry, education, housing, public works and communication. To achieve cooperation, planning at the country level is required to involve all sectors. The next principle is appropriate technology. Technology that is scientifically sound, adaptable to the local needs, and acceptable to those who apply it and those whom it is used, and can be maintained by the people themselves with the resources of the community and country can afford. The third principle is equity, equitable distribution. The first key principle in primary healthcare strategy is equity or equitable distribution of health services. Health services must be shared equally by all people irrespective of their ability to pay, and all, rich or poor, urban or rural, must have access to health services. Currently, health services are mainly in towns and inaccessibility to majority of population in the developing world. Community participation. Overall responsibility is of the state. The involvement of individuals, families, and communities in promotion of their own health and welfare is an essential ingredient of primary health care. Primary health care coverage cannot be achieved without the involvement of community in planning, implementation, and maintenance of health services. Essential components are elements of primary health care. We have 8 essential components and elements. We'll see one by one. The first one, education concerning prevailing health problems and the method of identifying, preventing, and controlling them. Promotion of food supply and proper nutrition and adequate supply of safe water and basic sanitation. Maternal and child health care including family planning. Immunization against major infectious diseases. Prevention and control of locally endemic disease. Treatment of common disease and injuries. Promotion of mental health. Provision of essential drugs. The extended elements in 21st century. Expanded options of immunization, reproductive health needs, provision of essential technology for health, health promotion, prevention and control of non-communicable disease, food safety and provision of selected food supplements. Primary health care in India. In 1977, the Government of India launched a rural health scheme based on the principles of placing people's health in a people's hands. Keeping in view the WHO goal of Health for All 2000 AD, the Government of India evolved a national health policy based on primary health care approach. It was approved by Parliament in 1983. Primary health care in India at the village level. On the basis, tenets of primary health care is universal coverage and equitable distribution of health resources. That is, health care must penetrate into the farthest reaches of rural areas and that everyone should have access to it. To implement this policy at the village level, the following schemes are in operation. We have 3 schemes working under this primary health care in India at the village level. One is ASHA schemes, then another one is ICDS schemes and training of local DAIs. ASHA schemes. ASHA must be a resident of the village, a woman, married or widow or divorced, preferably in the age group of 25 to 45 years with formal education up to 8th class, having communication skills and leadership quality. Adequate representation from the disadvantaged population group will ensure to serve such group better. The general norms of selection is 1 ASHA for 1000 population. In tribal and hilly and desert areas, the normal could be relaxed to 1 ASHA per habitation. Roles and responsibilities of ASHA occur. ASHA will take steps to create awareness and provide information to the community on determinants of health such as nutrition, basic sanitation and hygienic practices, healthy living and working condition. She will counsel women on birth preparedness, importance of safe delivery, breastfeeding and complementary feeding, immunization, contraception and prevention of common infections including reproductive tract infection, sexually transmitted infection and care of young child. ASHA will mobilize the community and facilitate them in accessing health and health-related services available in Anganwadi, sub-center, primary health centers. She will work with the village health and sanitation committee of the Gram Panchayat. She will arrange, escort and accompany pregnant women and children requiring treatment, admission to the nearest pre-identified health facilities. ASHA will provide primary medical care for minor ailments such as diarrhea, fever and first aid for minor injuries. She will also act as a depot holder for essential provision being made available to every habitation. And she has to organize a health day twice a month. Anganwadi workers and ANMs will act as a resource person for the training of ASHA. Easy activity through display posters, folk dance, etc. on these days can be undertaken to sanitize the beneficiaries on health related issues. Anganwadi worker will be depot holder for drug kits and will be issuing it to ASHA. Anganwadi worker will update the list of eligible couples and also the children less than 1 year of age in the village with the help of ASHA. ASHA will support the Anganwadi workers in mobilizing pregnant and lactating women and infants for nutritional support. Local DAIs. A scheme for training of DAIs was initiated during 2001 to 2002. The scheme was implemented in 150 districts in 18 states and union territories of the country. The districts selected were on the basis of the safe delivery rate being less than 30%. The scheme was extended to all districts of EAG states. The aim was to train at least one DAI in every village with the objective of making deliveries safe. Reference: the Park Book of Textbook Preventive and Social Medicine 25th edition and the Google references www.primaryhealthcare.com. Thank you for watching my video. Thank you once again.